All right, good morning and welcome to the Street Doctor Show right here on your favorite dial 106.9 FM, going the radio, the heartbeat of dialogue. And of course, as we always do it every awesome Saturday. Yes, I regard Saturdays as awesome days because these are the days. This is actually the day we talk about your health, the most cardinal thing you need to protect. As much as you want to make money, as much as you want to stay alive, you certainly have to stay alive and have that money with a good health. Yes, and of course, the Street Doctor Show, every week we have something cardinal. We always come, we always bring your way. And today won't be different because we have it hot. And I have in the studios Dr. Ike in the studio, the Street Doctor himself. Doc, you're welcome.
Thank you, my brother.
All right, if you're just joining us, this is 106.9 FM and this is the Street Doctor Show. And if you're joining us online, certainly you should be seeing us right now online on Narrator Niger, on Facebook and on YouTube. And of course, join us, be part of it, drop your comments, and as well, you can call in. So today on the Street Doctor Show, we are talking about self-medication and renal failure. And it's an offshoot from what we talked about last week when we delved on kidney. And of course, we promised that we're going to come back this week with something far more informative than what you got last week. And of course, just as I mentioned earlier on, I have Dr. Ike in the house. Dr. Ike is going to do justice to this. And remember, for you to be part of this program, you want to call in to ask questions and perhaps make certain verifications. Call us on 081-8888-1069. I repeat, 081-8888-1069 or on 080-7624-6701. I repeat, 080-7624-6701. So, Dr. Ike.
Yes, boss.
We are talking about self-medication and renal failure. And I want to ask you this very first cardinal question before we dive in. So can you just give us a simple explanation of what renal failure means? Okay,
in layman's terms, before I go begin to speak baby grammar, I can't lose my audience. In layman's terms, renal failure is when your kidney is having an injury, something they affect your kidney. And they always say that the kidney, they forgive. Why? Because most of the things where they affect them, it will take time for them to recover, really. And they get to stages where we say if you reach, you go demand for renal transplant. So, but renal failure, basically, falls into acute kidney injury. And when that acute kidney injury, or maybe they get repeated renal assault for a prolonged time, it can lead to chronic kidney disease. So in layman's terms, when the kidney is damaged, depending on what they cause the damage, but based on our topic today, we're talking about self-medication. So self-medication can actually be a cause of injury to the kidney.
All right, self-medication can actually be a cause of injury to the kidney. And then of course, just like I told you, today we are going to expand ordination. Remember to join this program, call us on 081-8888-1069. I repeat, 081-8888-1069 or on 080-7624-6701. I repeat, 080-7624-6701. All right, we are here to understand what renal failure is. And of course, what self-medication itself is. All right, Doc, I want to ask you this thing. What's the difference between acute and chronic renal failure?
Okay, acute kidney injury is when maybe the cause of that damage is for instance, dehydration. Say a person they drink water well, can actually lead to an acute kidney injury whereby the kidney they receive enough blood where suppose they nourish them. So the nephrons, that's the kidney cells, tubular cells, can actually then the kidney actually needs to be well rehydrated. Now why would they tell people say maybe they drink plenty of water? Okay, so now in that dehydrated state, anything where relate to things like sometimes some people will take some anti-malarials without being well rehydrated. So if they're not well hydrated, or maybe the person don't get dehydrated, maybe they vomit plenty times, and if they get fever and they lose water through in body and everything, the kidneys now will be needing good rehydration. So when there is lack of that adequate hydration in the system, it can affect the tubular cells of the kidney, and the kidney can, at that moment, they call it acute kidney injury. It can actually start, having damage to the nephrons, the cells of the kidney, and that's acute. Okay, it don't happen as they be.
As they be, yeah.
But now, chronic kidney disease, maybe person now they take medication with the touching kidney small. The kidney go just the chest, the damage small. Then by that time, once it don't prolong, that damage don't repeat itself for a long time, especially when someone is taking herbal medication. You not gonna know say it they affect the kidney. Herbal medications that are being made with heavy metals, okay? It can affect the kidney over time, metals like mercury and lead, whereby at a certain time, the kidney will just shut down. You understand? So at that moment in time, it progresses slowly. That is actually when it's called chronic kidney disease.
Wow. All right. And this next question is quite important. Okay, what are the most common causes of failure in our environment? We're talking about Nigeria, Enugu State. And just like you said earlier on, last week, it's becoming more prevalent.
Yes. I would want to say that one of the reasons why I actually wanted to talk about this today was because we lost a dear colleague, a Yoruba doctor in Port Harcourt. May he so rest in peace. He was laid to rest on the 5th of September. He was even the former president of university, president of the Port Harcourt University Medical Students Association. May he so rest in peace. This issue of self-medication, okay, is actually a challenge. And people don't seem to understand that if you take a drug without good prescription from either the doctor or the pharmacist, okay, or if you go and take the advice of a neighbor, or these street medications, or unlabeled herbal medications, these are the kind of things that can actually affect the kidney. And the prevalence in Nigeria, let me speak of, Africa, is largely due to self-medication, over-the-counter drugs. Maybe say person go they feel sick. You know, go even consult. If you get doctor friend though, or even you could just go straight to either the pharmacy or the chemist shop, or by the side of the road, or a friend will tell them, say, this thing don't do me before, go take this thing. People, you see, in Nigeria, the patients are more doctor than the doctors. Permit me to say that. I've been in a situation where even the nearby, road bystanders are now the ones who are kind of like now enlightening me in health, despite my introduction to them that I'm actually a health personnel.
A medical doctor, yeah.
So in the challenge we have in Nigeria is so multifaceted. So I don't know whether to relate the prevalence to poor awareness, ignorance, poverty, or the use of these medications, self-medications. So, but the prevalence has been proven by research. There is about 30 to 35% causes of renal failure is actually due to this self-medication. Yeah. So I would want to attribute it self-medication and improper approach towards treatment of illnesses.
Self-medication and improper treatment to illnesses. And of course, today we are trying, we're not trying to, we are warning you, we are begging. Health is wealth. But then you have to do your own part to ensure that you put every necessary actions needed to stay healthy. Remember, you can join the Street Doctor Show live right now by calling us on 081-8888-1069. I repeat, 081-8888-1069 or 0807 624-6701. I repeat, 0807-624-6701. Ask your questions, and then the street doctor himself is here to guide you and to help you. Every sickness is preventable. That's the point.
Not every, but make we no go there.
So, Doc, let me ask you, how can one recognize the early warning signs before it becomes life-threatening?
Because of the topic of today, in relation to self-medication and renal failure, let me go from bottom to top, according to our former president. I've been at top to bottom.
He said top to bottom.
So, a bottom to top approach. Renal failure, okay, fine. To start with, if you are having the symptoms that you look out for, when you the urine production wey don dey produce don dey lower than usual. Maybe, for instance, I'm going to use an instance. Maybe in a day you actually have urinated just once in the whole entire day. Okay, and then if you notice that your leg is swelling, and you notice that you are beginning to develop breathlessness, tiredness, confusion, dizziness, and facial swelling. Okay, I wouldn't want to use the one of the foaming of the urine, because that one is kind of like subjective. But then these are just basic warning signs that one should be able to look out for, especially when one is under self-medication.
All right. And I hope our listeners are paying very close attention, because the rate at which we are seeing kidney failures right now is crazy.
It's crazy.
It's crazy.
Even among babies.
All right, let's talk about lifestyle stress and kidneys. But before we go into lifestyle stress and kidneys, Doc, can you describe the situation in Nigeria? Are we seeing more young people develop kidney problems, or is it because more people are coming online to talk about kidney failures? But based on the statistics on ground, are we really seeing more young people developing kidney issue?
You know, I'm not a pediatrician to start with. So if you're talking about young people, I want to assume that you are discussing about maybe youths. Okay, fine. So, but before I actually discuss that, I would like to first and foremost describe what self-medication is, so that people can understand what we're talking about and why it is in relation to maybe whether it is more young or in the older age group. So self-medication basically refers to when someone takes a medication that is not really prescribed by the doctor or without the advice of a medical doctor or a pharmacist. Okay? Now, when someone takes a medication, leftover drugs at home, or tends to mix a lot of medications on their own without medical advice, or even goes and gets drugs from the roadside, that are street drugs, or starts taking herbal medications, sometimes in combination with even the prescribed drugs, without even telling the doctor. That's why they say, if you are taking anything, if you're under a prescription drug and you are on another medication, please ensure that you communicate to your doctor. Don't be too smart. Don't be more doctor than your doctor. Okay? Ensure that, because some of these components, you don't even know what the contents are. Some of the plants that are being used to make these herbal preparations might be nephrotoxic. They might be dangerous to the kidney. So when you are taking them, especially the unlabeled ones, you know, or the ones with the contents not even did the body, like Abodem and the rest of them, where you don't know what they use to. Tell your doctor. The doctor is not a magician, or I don't even want to know how to describe it. The doctor needs to understand that because if a doctor is treating you and the medication is not working, and meanwhile you're hiding that information from your doctor, it might complicate issues. So now, talking about the age group, is it more in young or in old? Suffice me to say that I really would not really say it is more in a young or old, because when we're talking about the kidney health, looking at geriatric age, the elderly are actually more susceptible to kidney damages. Why? For many reasons.
Okay.
To start with, we talk about issues like hypertension and diabetes. Okay, so if you do a comparative analysis, you might be able to understand that diabetes and hypertension is, as we age, as we grow older, we get to get into these conditions of chronic illnesses. Okay, so diabetes and hypertension have a way of affecting the kidney on its own. Okay, the younger age group, they drink a whole lot of alcohol. Well, let me just say that they drink a lot of alcohol. They are active, so so those ones are most likely maybe self-medication, alcohol, drugs, and everything might now be a factor that will be affecting them in their own category.
Yeah.
But then across board, when we get older, we are dealing with diabetes and hypertension. These conditions affect the elderly more than the younger ones.
Wow. All right. Thank you so much, Dr. Ike, for that expansion. Remember, this is the Street Doctor Show, and today we are talking about self-medication and renal failure. And of course, it's a very important topic that I know that every one of you out there is interested in. And then for you to ask questions, because I know you have questions to ask. Call us on 081-8888-1069 or 081-8888-1069 or on 0807-624-6701. I repeat, 0807-624-6701.
Chike, just to add on, there's this common situation, painkillers. I forgot to mention that a lot of people abuse painkillers and antibiotics. There are some antibiotics like gentamicin and amikacin that are nephrotoxic, and there are painkillers like ibuprofen, mefenamic acid, diclofenac that can actually affect the kidneys. So now in age groups, for instance, some of our elderly ones that are suffering from arthritis might just go to the chemist and they'll mix drugs for them. Okay, they don't even know the dose. The dose might be too high for them. You understand? And then frequency as well. Of course, they're not monitoring their medication, but the chemist does not understand how to probably monitor the effect of these drugs.
Yes.
So age-wise, I would want to say that when people actually go over to collect these drugs over the counter, I would want to say that talking about antibiotics and painkillers, maybe the young ones might be more predisposed to those segments of drugs because they are usually maybe from the stress, daily stress, and everything. They might want to be taking painkillers. And then most times when I walk into pharmacies these days, a lot of people now go into like as if as if that's the hospital. They go and they get treatment there. Okay, they might not have. I mean, in Igbo they say eke dolu eke. There are reasons why they have primary health centers. You have hospitals. Okay, the pharmacist knows about the drug quite all right, but when it comes to disease conditions, for instance, when it comes to for someone assessing your level of dehydration, I'm not sure the pharmacist is trained to assess those qualities. So these younger ones are actually the ones that actually walk into the pharmacy most times to get their medications. Yes. So you can see that it's actually it's the prevalence somehow has a tilt with respect to age.
Okay, I wanted to ask you this thing. You know, we're still talking about self-medication, and there's still a role size. You mentioned it last week, but I want us to expatiate on it because it's something you said last week about you need government agencies to step up their role
in terms of enforcement,
and then controlling the level at which people sell mixtures.
Regulation. Yeah.
Exactly. But then you still notice that there is this, you can't entirely take it out.
Yeah.
But then I want to ask you, what will you tell the average guy out there who is getting himself exposed to factors that will tilt him towards developing renal failure? And then, you know, some of them will tell you, I can easily go get this Gogo cleanser. Or I don't want to call anybody's name right now, but then, what would be your advice to these, to these guys out there? Because the point is,
Yeah, I get your point.
bro, what you're buying has no dosage. What you're buying has not been proven.
But,
so what would be your message to those guys out there buying those things? As it be so now, government know they want really step up.
You know, I honestly speaking, I like the direction of your question, because this is directed towards an advice to the young people rather than the government. It's not as if that the government does not know, but for one reason or the other, the people are the government and the government are the people. So while I'm advising those guys in the street, I believe that the government is also listening. They know what to do on their own part. So now, for young men and women, for our listeners out there, I would want to advise that, you know, say painkillers no be mineral. No, they drink them like, say, you know, because say it's a bit a painkiller make you no be at worst case scenario, if you want to treat your pain, I beg just buy paracetamol and take it on a safe dose. I know say before paracetamol go don't knock you. You don't know how long we don't take them, or the dose we don't take them. We use, so if you don't say you don't overtake them. But any other painkiller like ibuprofen, diclofenac, and all that. So those ones, I beg, make sure say you consult your pharmacist, a licensed pharmacist, no be student pharmacist, or maybe that one. I'm talking about licensed pharmacist and a licensed medical doctor that can be able to guide you and advise you. Especially, one more thing, when you consult a doctor, the difference is this. The doctor can actually, like, maybe over a time, get to want to monitor your kidney function and probably recommend you to go for what we call serum electrolyte urea and creatinine. It's more of like a kidney function test, or even a urine dipstick. Okay, these are just simple examinations. The urine dipstick is a non-invasive procedure. Just produce your urine and they'll just do a dipstick and test. And why the other one is invasive? Because they need to collect your blood and test in the lab. So these are just the advice I want to dish out for our people out there.
All right, if you're just joining us, this is the Street Doctor Show right here on 106.9 FM Gold Unit Radio, the heartbeat of dialogue. And I have in the studio Dr. Ike, and we've been talking about the self-medication and renal failure. And we are also telling you how best to take care of your kidney, because it's a cardinal part of your well-being. And remember, to be part of this program, call us on 081-8888-1069. Repeat, 081-8888-1069, or on 08076246701. I repeat, 08076246701. I'll repeat that number again, 08076246701. Ask your questions. The Street Doctor himself is here to receive all kinds of questions. You can ask in Igbo,
Why not?
If you speak for Pidgin, we they listen, we they hear you. All right, Doc. You know, we're talking about self-medication, but doesn't mean that every form of self-care is bad, because I know there are self-care methods, strategies that I've seen doctors, I've seen healthcare professionals proffer as one of the ways to prevent it.
I agree.
So, okay, let's start with lifestyle habits.
Okay.
Instant, they are still part of self-care. Perhaps we might not necessarily call it self-medication, right?
Yes, you cannot call it self-medication.
Okay, so what are these lifestyle habits directly linked to kidney damage? I will just tell us the ones directly linked to kidney damage and the ones that you should adopt for you to have a healthy kidney, especially when genetically you have a propensity of developing that.
Yeah, I didn't see your question coming, but I'm going to address it in a simple way that my audience can be carried along. You know, there are some conditions, kidney conditions like polycystic kidney disease, okay, that can run in families. So, let me also use another instance. Diabetes, hypertension can run in families. So, if you know that you have these conditions in your family, you should take care as to ensure that you check yourself regularly. Okay, routine checks. That's one. Two, also look out for the signs like I've mentioned: swollen feet, reduction in urine production. That's your urine output is reduced, swollen faces, tiredness, and all that. So now, the other aspect of it is when you're about to take any medication, there are some drugs that are safe. For instance, like I said before, when you want to take painkillers, one of the safest drugs you can take is paracetamol. Okay? It's not good to abuse ibuprofen or ibuprofen as some may call it, diclofenac, some drugs like mefenamic acid or antibiotics like gentamicin or amikacin. Okay, always try and at least consult a licensed pharmacist. I know that pharmacists are even much in our environment, are even much more approachable than medical doctors. So I'm going to use that advice to say that instead of going to the chemist that was not trained, it will be better you go to a pharmacist and get an advice from the pharmacist. If you don't get access to doctors because of the patient load and all that, or probably cost, but in our environment, people like going to the chemist because they want to boycott. In Nigeria, we like shortcuts, and because the money no day too, with poverty and unenlightenment, we want to. A lot of people call chemists doctors. Yes, I've seen a lot of chemists that they call doctors, even some nurses and even auxiliary nurses they call doctors. So there's a whole lot of things, it's so multifaceted. There are a lot of issues, but just try and have a good pharmacy. Now, let me tailor this down to the rural areas because I am public health oriented. Tailoring down to the rural areas, if you do not have access to your doctor, please try and at least a trained medical personnel. Primary health care centers, you can find them there. If not for anything, those guys are experienced. They have also learned from the doctors that visit those centers as well. So that's my advice.
All right, thank you so much, Doctor. Try and learn from experience, and of course, try as much as possible not to. In fact, the crux of today's discussion is avoid self-medication, and then do everything possible. Once you start noticing a couple of signs in your body, consult a certified medical practitioner.
Yes.
All right, and then okay, Doc, I want to ask you this thing: how important is hydration and diet in preventing renal failure?
Hippocrates, the father of medicine, would say, let food be thy medicine and let medicine be thy food. Now we are talking about self-medication. I would want to say that just like I said last weekend, that for me, the way I see diet is not just what we put in the mouth, okay? It's also what we drink, okay? And also, I would want to suffice me to also add other forms of dieting, like having the sunlight early in the morning that helps the kidneys to produce vitamin D that is good for our bones. Okay, that one is a different level of dieting for me. Okay, but then when we talk about diet now, I would want to say drink a whole lot of water. Okay, then eat good fruits. Okay, and veggies. Okay, these ones will help in detoxifying the toxins that might be dangerous to your kidney cells. Because talking about nephrotoxicity, toxins are also implicated. So if you are eating good food, if you are having a good diet that is rich with vegetables, fruits, vitamins, those ones can actually help in reducing the effect of all forms of toxins that you take in. But you can't get it wrong where you take good amount of water in a day. At least in a day, you shouldn't take anything less than maybe 3,000 mils of water. Okay? So let's say about 3 liters of water per day is very ideal.
Okay, 3 liters of water is very ideal, and that's one big assignment for a lot of people. One big assignment. Okay, and then can you stress more on stress management, because people, stress is part of it.
You don't come again.
Like, stress is part of it, because I know you mentioned sometime last week that where you were talking about why people mistake linking alcohol consumption to it, and then you made mention of hypertension. Some people that are hypertensive who don't know they're hypertensive, and then eventually become heavy drinkers.
Okay.
And there's a link. There's how you linked the two of them.
Okay.
And then I want you to make sure, because stress is a whole lot.
I agree.
Stress is a whole lot. So and then in today's Nigeria, people are stressed from every angle.
Okay.
Finances. Okay. On the level. On the employment.
Plenty, bro.
Bills.
Pressure too much.
Plenty things. So can you just touch it up a bit?
Okay. In connection with self-medication and renal failure, stress is something that worsens hypertension. Okay, and then stress can also cause body pain. Stress can as well, make one to probably want to have a quick access to a medical advice, which will now push them to go to the chemist. The stress is too much. Some people might be having signs and stuff of renal failure, and they'll think they have malaria. Okay, and when the person now probably goes into taking this self-medication, they might end up worsening the condition. So, in relation to stress, the kidney can also be stressed by stress. Stress produces a whole lot of free radicals in our system. These free radicals are actually now supposed to be excreted by the kidney. So when someone is stressed, there's also a chance of the person to also, lose water and be dehydrated, which can also have a cumulative effect with the combinations of because when there's reduced volume of blood getting to the kidney, it affects the kidney. And then when we talk about the products of stress, which includes the free radicals, it can actually also equally have a cumulative effect on the kidney. So I want to say that reduction in stress, going for a routine checkup, and also ensuring that we seek for appropriate medical advice from the licensed health practitioners is key in managing stress. And then, of course, for those who are not aware of their hypertensive states, please just do well as to ensure that you do your health checks, blood pressure measurements, because a lot of people are walking out there with very high risk blood pressure, and stress is one of the causative factors of high BP. So if you don't control that blood pressure, it can affect your kidneys, and your kidney is going to get damaged. So my people, now don't hear them. That's what it be.
So the point is, if you don't control that blood pressure, it can affect your kidney.
Yeah.
So Doc, let's come down a bit. We're talking about you've already mentioned the importance of medical follow-up, and then I want us to talk about some myths. I've seen situations where people say that MAMA.
Okay.
Akoya poison. The before akoya poison. Like, now there's mythical things that. So what would be your message to people out there? Because it gets so complex when you find yourself in a situation whereby this person obviously is having this early warning signs of kidney, but
and
then instead of them taking this person to medical practitioners, to a certified medical practitioner to look into it, they'd rather take the person to the church or to a prayer house for prayers to happen,
or even to the traditional medicine.
So some people might even come up with the argument that So say him about doctor.
Oh yeah, one number on cause.
So, what would be your advice to people out there?
Okay, I'm a scientist. I'm a medical doctor, so I want to talk from what I know. Basically, some wike will say inyandeba. As for those people who are believing in those myths, please, I'm not saying that you should not believe in what you want to believe. We are all entitled to what we believe, but please, as you are believing in those things, can you just do a favor as to approach the correct medical practitioner? Try and reach out to a medical doctor, a licensed medical doctor, or a licensed pharmacist. A licensed pharmacist understands these things and might probably refer you to the hospital for checkups. So, what am I going to say? Some of these medications that you might take in that traditional medical store, you don't know the contents. You don't know how they were processed. You don't know the phytochemicals that are in those those herbal mix. Whether they are nephrotoxic or not, you don't know. And once this thing, because one of the things that happens to our people is that something they don't understand, they attribute it to spiritual causes.
Yeah.
And that's why I say that our people are more doctor than doctors. Because when someone starts having the effects of some of these things for which they don't understand, they might probably be thinking it was sent from the villagers. And sometimes, now they cause them by ourselves. Sometimes we might keep, expired drugs at home, and when something happens, we go and take it. Or some medications might be at home, someone might just take it and overdose on it, and it will cause damage to the kidney. And then it will look as if someone has sent something from elsewhere. Okay? So some of these things are the things that we don't understand. And once someone can start having generalized body swelling, anasaka. And this anasaka is actually one of the signs of kidney damage. And of course, some people might be having swollen foot. They don't know it's their kidney that is damaging. Mm. And they will say, no, you know, and all that. So, my people, so let us understand that understand these things and try and reach out for a proper medical, not your neighbor, not your friend, okay, that is not medically inclined. So just do well as to reach out to a licensed medical practitioner, and I believe that it will be handled from there.
All right, thank you so much, Doc. And you're still on to the Street Doctor Show right here on 106.9 FM going in the radio. And of course, Dr. Ike, the Street Doctor himself, has been doing justice, talking about self-medication and renal failure. And of course, remember that you can join this show live and call in to ask your questions. All you need to do is call us on 081 888 81069. Repeat 081-8888-1069, or you can call us on 08076246701. I repeat 08076246701. Doc, before we wrap it up, I want you to talk about the role of family and community support. What role do you think family members can play in supporting patients as well as community?
Chigeze, I say you're going to give me these questions before I come show. Don't mind me. So now, the role of family and community is in spreading the right information. Okay? We should understand that the advice we give the next person who is under these conditions, maybe at the time where someone is not feeling fine, there are some safe drugs, at least first aid, that are acceptable. Maybe someone is having fever, you say, okay, take paracetamol, take enough water, and then if it's malaria, you can get an anti-malaria drug over the counter, an ACT, artemisinin combination therapy. And that one is a safe start, okay? But then where you now notice that these symptoms are not alleviating, like they reduce. The next thing, or you notice that the person is now developing breathlessness or is now getting dizzy or confused. The next thing we go do now to just say, I beg, go to the hospital. Okay? So that is the role I expect families and community to play, rather than making the matters worse. For instance, you can come to a place where there is an accident and you see that the community are not really aware that they are causing more damage to the victim. They will try, and maybe someone that has a spinal cord injury, they might want to assist the person, they will cause more damage to the spinal cord. Or a place where you see that the person needs space to have good ventilation, and people will be crowded around the person. You know, these are just instances I want to use to explain what not to do. Refer the person to a nearby hospital or call in the attention of a licensed healthcare practitioner. Thank you.
All right. Thank you so much, Doc. And Doc, before we wrap it up today, what will be your final message to people out there about renal failure, about self-medication, and then about overall kidney care?
Okay, I would want to say do justice or do well as to have your system well rehydrated, take enough water a day, and avoid self-medication because it's dangerous. And we all know that delay is dangerous. So anytime you notice these symptoms that I've mentioned, symptoms such as swelling of the feet, the face, tiredness, and all that, do well as to rush to the nearby hospital or call in the attention of a licensed medical practitioner. Thank you.
All right, thank you so much, Dr. Ike. And in case you just joined us, of course, we are about to wrap it up. This is the Street Doctor Show right here on 106.9 FM Go Uni Radio, the heartbeat of dialogue. And of course, the Street Doctor Show comes every Saturday by 5 minutes after 10. And then together we talk about issues concerning your health and your general well-being. Thank you so much,
Yes,
Dr. Ike.
To say too.
Okay.
So for our people out there, if you go, assuming you want to go and do a routine check, and you notice that you have some degree of protein in your urine, please do well as to reach out to the street doctor on 0810 910 4348. I repeat myself again, 0810 910 4348. Thank you very much.
All right, thank you so much. Thank you so much, Dr. Ike, and thank you so much, our listeners out there. And if you joined us online on Narrator Niger, thank you so much for joining us online. And of course, every week we promise you we'll be bringing you hot topics, hot issues that will help you stay healthy and stay alive, because at the end of the day, the drive is to make money and to still have good health.
Yes, now,
to enjoy that
without
money.
good health, I want to enjoy the money. My brother.
All right, this is still the Street Doctor Show, and of course, this is a wrap for this week. My name is Chikeze Omona. Once again, I want to thank Dr. Ikenna. Doc, thank you so much for coming around.
And thank you, Go Uni FM, for giving us this platform to share the gospel of good health.
All right, and of course, we hope to see you next week.
Absolutely.
All right, until we see you next week, keep staying healthy, keep drinking good water.
And reduce taking of too much painkillers.
And as well, reduce stress. Reduce stress. It go better.
Stress,
No go kill yourself with plenty work.
Yeah.
All right, see you same time next week. Bye-bye.
You go well. Take a like.
Dog.